Hey, welcome, namaste. Corona, climate change, a growing population and depletion of natural resources. We're facing great challenges and we must think and act differently. Innovation is more important than ever and we're running out of time. Vinnova is Sweden's innovation agency, and our mission, simply put, is to enable innovation that makes a difference. We are grateful for the brains and the brave who are making the transformation happen. People with the courage to pioneer the possible. People who challenge themselves and others to adapt and change. People who go the extra mile to give the next generation hope for the future and fulfill our commitments to the SDGs, and you are many. This is the time to partner with us and others who are determined to meet the SDGs. Let's not miss this opportunity. There are lots of promising solutions on the way, but we need more. Join us to find the way forward. Let's push the boundaries together. Let's pioneer the possible. Welcome to the Indo-Swedish Health session during Sweden Innovation Days. I'm Malin Petersen, Country Manager for India at Vinnova. We have an impressive speakers list. You'll hear about the inspiring examples of Indo-Swedish Health Cooperation, about funding opportunities and upcoming activities and events. First out to deliver a message is Miss Petra Noreback, State Secretary to the Swedish Minister for Social Affairs and Public Health. Our Indian audience in particular, please meet State Secretary Noreback.
Good afternoon. My name is Petra Noreback and I am the State Secretary to the Minister for Social Affairs and Public Health in Sweden. I am very happy to be able to speak to you today at the Indo-Swedish Health session during the Sweden Innovation Days. As you may know, India and Sweden celebrate 75 years of diplomatic relations this year. This is my first participation in our long-standing health collaboration. But I know that there are plenty more to come, and I look forward to it. Sweden and India have a memorandum of understanding on health since 2009. I have learned that our bilateral memorandum is one of the most successful and important agreements between India and Sweden. During the years, there has been numerous visits on ministerial level between our countries, and I know that several of my colleagues in the Swedish government have already had the pleasure to visit India. I am very proud and happy to carry on this tradition and look forward to visiting India and carrying on the fruitful collaborations. Two of the important factors for the success of our collaborations has been commitment and the construction of the memorandum and its three pillars: public, private, and academic. We aim to have collaborations on all these levels, and I can confirm that a variety of actors, including some of the best Swedish companies within healthcare, government agencies, as well as Swedish academic institutions and university hospitals, are working together with their counterparts in India. We all truly see the potential in Sweden-India collaboration. The success of our Memorandum of Understanding has kept up through the pandemic. However, the pandemic has shown that we must build new partnerships between infrastructure actors and the private sector. And we need to find innovative ways for businesses, investments, and innovation to build sustainable and resilient healthcare systems for the future. I understand that India is going through some exciting development in the health sector, and so is Sweden. To follow our progress and keep up the innovative collaborations, we use the joint working group between the Indian and the Swedish ministries that are responsible for this memorandum. The joint working group meet once a year to evaluate the progress of the collaboration and agree on new thematic areas to work on, considering developments in both countries. And I hope that this webinar brings you a lot of new ideas that can be developed together between actors in India and Sweden. We are ready to support you on the joint journey. Dhanyavad.
Thank you very much, State Secretary Noreback. Truly appreciated. Now over to Ambassador Jan Thesleff. And as we heard, India and Sweden are celebrating 75 years of diplomatic relations this year. Both innovation and health has been important cornerstones in Indo-Swedish cooperation. Could you please share some more light on this, please?
Thank you, Malin. Thank you for giving us the chance to connect from Delhi. And I would also like to thank our State Secretary for her words that really show the government's commitment to this partnership that we have. 75 years of diplomatic relations in 2023. And we have gone from building up relations both politically, economically, scientific, in innovation. And the India-Sweden innovation partnership is really at the forefront of what we want to do for the coming 75 years. So much is happening in India, so much is happening in Sweden, and so much that we can do together. We've had a close relationship when it comes to healthcare. It goes back to the 1960s and to the India population project in those days. But this has accelerated over time. The State Secretary referred to the 2009 memorandum that was signed between our ministry and the Indian Ministry of Health and Family Welfare to promote cooperation in the area of healthcare and public health. There is another milestone, and that was the visit by the Honorable Prime Minister Modi to Stockholm in 2018. On that occasion, our respective prime ministers signed a joint declaration on innovation partnership for a sustainable future. And based on that memorandum, based on that partnership, Vinnova, together with Indian partners such as DST and DBT, have built on joint calls, knowledge exchange of researchers, strategic dialogues, and projects. I am delighted that today at this health session, we will also be joined by Leif Johansson, chairperson of AstraZeneca. He will be accompanied by Cecilia Oskarsson, who is heading Business Sweden in India. And we are also delighted to have Dr. Baipai, the Dean and Head of Pediatric Surgery at AIIMS Delhi with us. They will discuss and take stock of the India-Sweden Healthcare Innovation Center that was launched, set up in connection with the state visit of His Majesty King Carl XVI Gustaf in India in 2019, and to see how we can further deepen our collaboration. We are also very delighted to be joined by representatives from DBT, BIRAC, and the Office of PSA. And I would like to thank these partners for the day-to-day cooperation we have with them. Really, this is the backbone of what we do in this sector. What has happened recently? Well, just as recent as last week, a memorandum on researcher mobility was signed here in Delhi in the presence of the Swedish State Secretary for Foreign Trade, Håkan. So there is progress even in the most recent days. We mentioned 75 years of diplomatic relations. This year is a very special year for Sweden. We are holding the EU presidency, and we are very happy to be partnering with the EU delegation here in Delhi when it comes to the Health Innovation Days. So I would like to extend a special thanks to Mr. Stefan Hogan, who is joining us today also from Brussels, and also to Pierrick Filon-Ashita, who is here with us in Delhi today. We are committed to build on the existing partnership that we have. We all know that status quo is something that kills, while movement and innovation breeds life. That is the backbone of our health innovation partnership. Malin, thank you so much for having us connected from Delhi today, and all the best for today's meetings and deliberations.
Thank you very much. It was a pleasure having you, Jan. Thank you. Next, we turn to Mr. Johansson, Dr. Bijspa, and Ms. Oskarsson. Cecilia, I hand over to you to lead this dialogue on Indo-Swedish building successful collaboration on innovation within health, including the example of Indo-Sweden Healthcare Innovation Center driven by Business Sweden. Cecilia, please.
Thank you very much, Malin. And as we have heard today, healthcare has really been one of the key areas for collaboration between India and Sweden since a long time back. And through this collaboration, we are able to drive some of the key work streams, including improvement of pediatric care through ICMR, which is Indian Council of Medical Research, and FORTE for the collaboration, but also management of AMR with the collaboration between public health agencies and National Center for Disease Control. There has also been multiple delegations from both sides enabling exchange of information, and the last one only in December 2022, where representatives from Sweden met with partners here in India. Another initiative that we have been driving during this collaboration is the India-Sweden Healthcare Innovation Center. And that is a tri-party collaboration between the two All Indian Institute of Medical Science in Delhi and in Jodhpur from the Indian side, and from the Swedish side, Business Sweden. And these two Indian institutions play a very important role for us in policy shaping related to healthcare in India. And along with those two institutes, we as Business Sweden, together with the whole team Sweden, are governed also by Ministry of Health and Family Welfare from the Indian side, and Ministry of Health and Social Justice from Sweden. Together with us, our knowledge partner AstraZeneca and NASCOM, but also technology partner Orexo and Scandinavian Chemotech. And over the past 3 years, we have achieved good progress in driving the key pillars of the centers. And today, we have the honor of having two very important partners with us today at the center. First of all, Dr. Bijspa, Dean Academics and Head of Pediatric Surgery at AIIMS Delhi, and Mr. Leif Johansson, Chairman at AstraZeneca, joining us for this discussion and reflection on the progress of the center. So Dr. Bijspa, if I may start with you. AIIMS Delhi is a pivotal organization driving innovative healthcare practices in India and has been a key partner for the Innovation Center. How do you see that some of these innovations developed by the center has been used by the public healthcare system, and then by that benefited patients, and doing that by your AIIMS participation?
Thank you very much. Very good afternoon to all of you. Thank you, Cecilia Oskarsson, the State Commissioner. I would also like to thank Honorable State Secretary, Madam Petra, His Excellency Ambassador Jan Thesleff, other representatives from Sweden and institutions in India. First of all, thank you very much for inviting AIIMS Delhi, which is our tripartite partner in this whole innovation center. It has been a very impactful partnership. Let me tell you at the outset, we have touched 50,000 patients and it has been impactful. We have trained about 400 plus nurses. We have sent 3 calls for startups with a very good response. Almost 2,000 people responded, were shortlisted. And we already have in very niche areas, 24 startups working, and the work is now visible. Now, if you look at these statistics in a short period of time, ever since Her Majesty the Queen Sylvia had visited us in December 2019, and even if you discount the 2 years of pandemic, there's been a phenomenal growth. And as a result of this, we are very encouraged to continue our partnership. We have identified there are certain areas in countries like ours with a huge population. If you look at a country like India with a 1.4 billion population, which is fast increasing, we have a huge turnover of patients in the hospitals. And we would like to deburden it. And some of the diseases, especially the non-communicable diseases, they require frequent follow-up and monitoring. Some of the three important gadgets which are being developed by the startups are addressing the problem for country in a very big way, and just like for any other country, more so for us. So for example, if you look at certain, like LVO Fit, there's a device which is handheld. Patients come for respiratory illnesses and we examine them as physicians. Then we want to monitor them on a close follow-up. Now, for this monitoring and this assessment of parameters, patients have to come all the way to the hospitals. Now, going to the hospital every time, overburdening the facility can best be avoided if we have an equally good device which can monitor such patients at home. LVO Flit, which is being developed by this tripartite arrangement and the startups, is just addressing that issue. So these patients would monitor themselves at home. They will look at the parameters. Are they following the advice of the doctor or not? If things are declining, they can correct themselves. So therefore, the number of people who will trickle back to the hospital would be very smaller now. So not only the disease will be addressed more robustly and close monitoring will be done, it reduces the cost of travel, it reduces the burden to the hospitals, and therefore the demand of hospital and advances and the more diseases which can become more severe can be curtailed at that level. That's one example I think should be reciprocated in countries like ours, in other institutions also, and I think we are working together on this. The second example is Cure AI. We have huge number of X-rays. The country has launched the digital health mission. The Prime Minister wants that all the investigations should be seamlessly traversing between referral hospitals rather than carrying them hard copies. Now imagine if such a high stream of X-rays and imaging is reaching, that it is much easier if AI can detect at least the middle of the curve, the huge numbers which can be tackled, and only some of them would require referrals. So this is another very good input, which is very useful for a country like ours. The third is TriCog. Now, TriCog is another device which can pick up acute myocardial conditions very early on. So before it goes into full-blown, full throttle disease severity, early detection, early management can be instituted. This would reduce our disease burden to a large extent. As you are all aware that this COVID especially has brought attention to our countries that we should be able to be more proactive in wellness. And the Prime Minister of India had already launched a program even before COVID, what is called the Ayushman Bharat program. This was wellness, so that prevent disease from happening. And with COVID, there is a socio-cultural change. And people now believe that they should go in for more active checkups. So the current health minister has launched a program, Dr. Mansukh Mandviya-ji, that he is now looking at having more multi-specialty outpatient-based hospitals. So patient can come regularly, and so that they can pick up the disease early and the management can be instituted. So in short, if you allow me, we are moving towards a situation where this cooperation between us is leading to development of those devices, which is a need of the hour. And as a result of this, it will help a huge number of patients, not only in India, but also elsewhere. Thank you very much.
Thank you very much for sharing those 3 innovations and for your words. Mr. Johansson, over to you. AstraZeneca has been a key partner in driving the center, but also using this collaborative approach. And can you explain and elaborate a little bit on how you have seen the center develop, and what are your key reflections related to the center?
Well, I certainly share the enthusiasm expressed by the previous speaker from AIMS, and let me express a good feeling of good cooperation between the different founding entities of the center. We have very much enjoyed having been a knowledge partner. And to some extent, we have tried to contribute knowledge, but in an even higher extent, we have also learned a lot. I think the 3 examples that were spoken about here earlier are good examples of that. But behind those 3, there is actually a multitude of very good ideas. And if I reflect a little on how innovation comes about, as you remember, AstraZeneca had a vaccine effort that was really academic, Oxford University vaccine knowledge. We developed it, and frankly, together, especially with India, we made 3 billion doses of vaccine in 18 months for 180 countries. That's the type of scaled up innovation that I think we should really be impressed with. And great thanks to India for having participated that with the Serum Institute. If I look at what actually comes in innovation, you can say there is usually no lack of ideas. The real challenge is for most countries to have those ideas and develop them and then be able to scale them. And that requires funding. It requires good governance around those. And in our case, as a large company, you can say we are part of a symbiotic system where together with government, together with academia, and together with many small companies and startups, we can actually help scale up and fund a number of those innovations. I think it's actually interesting on reflection to see that very large companies are often innovative. Pharmaceutical industry, we have great pharmaceutical industry both in Sweden and India, clearly represents that. But small companies are that also. And when we come together, then we can actually achieve things that neither of us, either a small company or a large company, would otherwise have done. And with the right attitude and the right governance, and I think we have fared very well in India and in Sweden on that, with support from government and also academia, we have actually managed to do a number of startups, a number of good things, especially in the area between digital and healthcare. And I think that's an area where India has a great expertise, Sweden has a great expertise, and where we can do wonderful things together.
Thank you, and I can only agree. So, Dr. Bajpai, very quickly, boundaries for healthcare and innovation are thinning across the world. And do you believe that these kinds of partnership is driving the change in the global ecosystem?
Thank you very much, Cecilia. Yes, we all believe in one earth and one health. Most unfortunate situation of COVID has actually was a silver lining for us all to understand that there is one health. People travel a lot, and so there are no boundaries. They are merging together. His Excellency talked about the vaccination, and also the company had talked about the vaccination drive at all. So I think currently it's one earth, and therefore we should, what we are doing is going to seamlessly spread across all nations and all mankind. So therefore I would like to make some brief points. As I mentioned that today, we are all looking forward to a big data. That is, we want, because this is digital times, whatever is being done in one corner of the world, it should be tabbed as a statistics which can build up our experience very fast. Today, the knowledge has a very short shelf life, and therefore this explosion and this research which is going on in our countries or their countries, they should be clubbed together and we should keep on building up our experience. I think that this particular thing is helping us a lot. And India, especially as I am repeating that, we have a large number of patients. We have a variety of diseases. Over the last 30 years, our communicable diseases have been replaced by non-communicable diseases. So India is a capital for many NCDs. Our government has made huge efforts. We are increasing the undergraduates, which is the denominator. As a result of that, we are also been able to increase the postgraduates. We are increasing the number of specialists in each area. And all of this is contributing to closer patient care, accruing of critical data, which are being pulled up and then put together in digital form, which will be exchanged all over the world. So therefore, all the inputs which are happening and all the devices that we are going to use currently and using already, the data is being collated. So your question is very pertinent. This data seamlessly is available for all of us to do research and improvise patient treatment. I would put it like this, that because of this, we are able to scale up and improvise our current technology, improvise patient care, and the data is there for us to tap. And we should be boundaryless in that context.
Yes, thank you so much. I've been told that we've run out of time, unfortunately. However, I do want to say to both of you that we have very much enjoyed working together with you for the past 3 years, and we do hope that we will continue this collaboration for and quite some time going ahead. I also, at the same time, would like to invite any other partner, technology, academia, or policy, to join us and to make a difference in the healthcare area for both Sweden and India. Thank you very much.
Thank you. Good to have been with you.
Thank you very much, Mr. Johansson, Ms. Oskarsson, and Dr. Bieshpa. Thank you very much for joining us at Sweden Innovation Days. We move on to Dr. Per-Arne Wikström, Science and Innovation Counselor of Sweden to India. Please.
He's a good guy. This guy.
Okay, hello Malin, hello everyone. Just to make some brief comments here on the whole or the general agreement that we have when it comes to science and innovation and the collaboration that we have. I would like to point towards some things that we've all heard about here, and that is that we, both Sweden and India, we share a lot of common values. I would say sustainability, definitely, you hear it all the time, responsibility, but also doing more with less. We're very efficient when it comes to how we want to use our different resources. And I think that together, and as we have seen, and as I believe that we will see in the future, that we will have a lot of more co-innovation, co-creation to create solutions for global challenges. And I would also say that, take the opportunity here to say that we from the Office of Science and Innovation that in India, we're very happy to facilitate these kind of linkages between Sweden and India. And as also the ambassador mentioned, we have the recent signing of between STINT and SCRB on research and mobility is one testament to that. But and what I also can see for the near time here is that we will have matchmaking delegation trips. We have one delegation from India in Sweden at the moment, I know, and we will also have Swedish delegation trips coming to India, and they have been here also within various areas, and of course health is one of them. We also have exchange between innovation clusters related to health. We're also working on developing joint centers of excellence. So there's a lot in the pipeline. We're also actually trying now to link Swedish regions with Indian states, which is a really interesting thing. So to sum it up, exciting times, and I'm very thrilled to be part of this process. So thank you, and back to you, Malin.
Thank you, Per-Arne. Indeed, a lot in the pipeline. Please do join us in our LinkedIn group, Sweden-India Innovation Initiative, to stay posted on upcoming activities like the ones mentioned. In this group, we also post info on upcoming funding opportunities. On the slide you've seen now, there are even more examples of good Indo-Swedish collaboration within health. Just to mention a couple, Forte, the Swedish Research Council for Sustainable Development has, they fund joint projects together with ICMR, and the EU are planning to fund a couple of Swedish research institutes to conduct a mapping of interesting areas for collaboration between Sweden and India. So in just over a month, on the 27th of April, Vinnova organizes an information meeting where we share more info on some of these examples. So please join us on the 27th of April. In fact, already today we will share some more info on a funding opportunity coming up. Therefore, I invite Dr. Vinita Chaudhary from DBT, Department of Science, Biotechnology, please.
Thanks, Malin. Thanks for inviting me from the department. Yeah.
Thank you very much, Vinita. Together we have identified thematic areas where we believe there are mutual strengths and complementarities between Sweden and India.
Yeah, actually, we are very happy with this collaboration. This is a strong collaboration which we have with Sweden since 2018, when we signed our POC with Vinnova. We started our collaboration. For almost all 4 joint calls we have announced in the various areas of health sector. The first call was announced in the area of tuberculosis. Second and third was in the medical devices, medical diagnostics. Fourth call was in the area of AI-based technology. And we are very much happy that in all 4 joint calls, we have supported 22 projects. And these all projects have led us to a very good leads, which is very much important for our joint activities, as well as to strengthen our relationship with Sweden. Yeah.
Yes, thank you, Vinita. And what do we fund within this call?
We are very much happy that we will announce our next call in coming months, maybe definitely June or July, we will announce our next call. And our call will be in the particular 3 areas we have prioritized. The major area is health, definitely, but considering the significant importance of AI-based technology, as we all know, these AI-based technology are the intelligent healthcare system, maybe you can say. In today's rapidly changing healthcare landscape, the need for fast digital transformation is crucial in driving operational efficiencies, clinical care delivery, and enhancing patient care while keeping costs at an optimal level. So all these factors are literally very much important. So based on that, we thought we will announce our joint call in the areas of like AI-based technology. Was our first sub-thematic area will be AI-based technology in healthcare systems. Second will be in biodesign, and third will be in circular economy, which we have already announced with other Swedish agency, but based on the previous experience in that call, we found that it's a wonderful area to work on once again. So we are happy that with mutual interest, we can once again support R&D efforts in this area.
Yes, thank you. And on the Swedish side of the projects, we encouraged participation from different types of actors, like universities, university hospitals, research institutes. And Vinita, which organizations are eligible to apply on the Indian side?
Actually, from the department, we usually support only the academic institutions. Any academic institutions from India, like the government also, government as well as private sector, even the NGOs can also apply under this call. The limitation is for the companies, since the department is supporting only the academic institutions. So we usually limit our conditions to the academic institutions. And for any startup or industry, if they would like to have such interaction or collaboration with industry, maybe they can go through our different perspective, like when we will join hands with BIRAC, which is our PSU. Through that lead only, we are supporting industry. So we are restricting at this moment for this joint call. We will support the academic institution. We will invite the proposals from these organizations only.
Thank you, Vinita. On Vinnova's web, the most essential info will be made available today. Right. So, Vinita, do you mind sharing some more info on the next steps, please?
Actually, if you can, if the concept note will be ready, if we will formulate our call doc, definitely in the mid of the year, we will announce our joint call. And we will give at least 2 or 3 months to the investigators so that they can conceptually evolve the proposal in all different 3 areas which we have. We are trying to mention in our call doc. And by the end of the October, we will try to close this call, and we will give almost 6 months for the evaluation process. Our evaluation process is also very much streamlined. First, we will go for the independent evaluation, and based on the independent evaluation, we will shortlist the proposals. If they will be mutually agreed from both the sides, we will accept those proposals for further consideration. And suppose in any case, we found some kind of non-matching kind of mechanism. In that case, maybe we can go ahead for our joint panel evaluation also. So these 2 level evaluation we usually keep in our bilateral partnership programs. And later, by the end of March 2024, we will announce our result, and we will start implementing our projects by mid-2024.
Thank you, Vinita. The Swedish participants in the project can apply for 2.8 million Swedish crowns, corresponding to approximately 250,000 euro. We have earmarked funding for 5 projects, and companies seeking funding are expected to co-finance their costs by 50%. However, startups, according to a particular EU definition, may receive up to 70% grant. So thank you again. Thank you very much, Vinita, for joining. I look forward to many more years of collaboration with you and your colleagues at DBT.
Thank you, Malin. It's a wonderful collaboration. We are also very happy to collaborate with Sweden. Thanks.
Thank you. Thank you. We turn to Mr. Ulf Borbos, International Project Manager at Ignite, Swedish Incubators and Science Parks. Please.
Thank you so much for giving me this opportunity to tell a little bit about what we are doing when it comes to improving and enhancing our ability from the Swedish side to cooperate with the Indian actors. Together with the Swedish Innovation Agency, we started the journey to find a way to improve our ability to work together with India, because we could find in our survey that we had very little knowledge about the Indian innovation system. So we started up a strategic work together, and now before we had it planned with Vinnova, but now we also have involved Business Sweden, the Science and Innovation Office at the embassy in Delhi. We also have IVL, and we also have Ignite, and of course Swedish Incubator and Science Parks. There's someone talking at the same time I'm talking, so please put off the microphone. And I'm the head manager of this strategic delegation trips we are doing. We have several targets in our work. We are trying to strengthen and enabling more of our Swedish innovation environments to cooperate actively with India. And we are eager to go to action because we think there is a huge opportunity for both countries to improve our ability to make a better world. We also want to enhance our knowledge about each other, strengthening relations, create trusted networks to create and be able to have a long-term relations with the relevant actors. And we want to develop our abilities to work in projects, which means that we want to implement things that will help the world to become better. By this strategic work, we will create more possibilities to find Sweden-India project cooperation. And in our strategy now, we have 3 strategic delegation trips that have been executed during 2022 and the beginning of 2023. But what I would like to promote right now is our 3rd delegation trip that is going in the end of 2023. The outcome of the previous delegation trips has been very, very valuable for every participant that has been on this trip. It's amazing how well our culture can match as soon as we meet and we start to talk about real problems and real challenges. Our third trip will have a thematic area in health and digitalization. And I would really like to encourage our Swedish actors in the innovation system and also innovative SME companies to follow us on our website at CISPA and at Vinnova to have a look when we are releasing our third delegation trip. I think we will release it in April, May, so you can follow us on this webinar that Malin was talking about. If you apply to this and you get approved to be on this trip, you don't only get travel grants so you can finance the trip to India, you get also a very valuable program to meet the relevant actors, and it will be profiled on the demands from the companies and the innovation actors. Yeah, I think that is all I have to contribute at this time, but please observe and follow us at Vinnova and at CISP so you can see when the release is coming. Thank you so much.
Thank you for sharing, Ulf. Now to our last speaker and to what many of you have been waiting for, EU funding. I invite Mr. Stephen Hogan, Head of Unit for Health Research, European Union, please.
Thank you, Malin, and thank you for this opportunity. My name is Stefan Hogan. I'm Head of Unit for Health Research at the Health and Digital Executive Agency. And I think I've skipped one slide too fast. I will briefly present the agency, how it works with the European Commission, as well as the funding opportunities, including specific opportunities for EU-India cooperation. The European Health and Digital Executive Agency, or HADEA for short, was established by the European Commission and is operational since April 2021 to manage funding program on its behalf. HADEA implements specific funding programs, including parts of the Horizon Europe program for health, digital, industry, and space over the period 2021 to 27, with a total budget of just over 20 billion euros over that 7-year period. HADEA also manages ongoing projects from the earlier Horizon 2020 program. Regarding how the executive agencies work with the European Commission, in short, one can say that the Commission defines policy while the executive agencies turns this policy into action. For instance, in consultation with the member states, the European Commission defines the priority areas for research and translates these into the annual work programs. The Commission also makes key program decisions, including, for instance, approving the choice of experts for evaluations and the projects to be funded, although this is based on the evaluations that are carried out by the agency. In complement, the role of the executive agencies is to publish the calls for proposals, to organize the evaluations, to prepare the grant agreements, and to monitor the projects throughout their lifetime. The agencies also support communication activities and provide feedback on policy making. HADEA implements Horizon Europe Health Cluster, as well as the Cancer Mission. I won't go into the other programs. And we currently manage already 265 Horizon Europe projects in health and over 400 projects that are still ongoing from the previous program, Horizon 2020. The areas that we cover in the health cluster are along 6 major objectives or destinations, which cover a wide range of areas, as you can see from this slide, which I won't read. In addition, we have, as I said, the cancer area, the cancer mission, which has 4 major objectives, which again, you can see on the slide, from understanding, preventing, optimizing diagnostics and treatment, and supporting quality of life. And for each of these, we have specific calls, which I will come to in a moment. These calls, as you can see, range for the health cluster in 2023 and 2024 are already published and available. You can see that there are 29 topics already foreseen in 2023, with just almost 850 million euros to be awarded in grants. And there's just one call with 4 topics in 2023 for the cancer mission, totaling just over 110 million euros. And the deadlines for both of these calls are really coming up very soon, on 13th of April and 12th of April, respectively. We also already have the calls for 2024 for the health cluster published. This information is already available, but the deadlines for the single stage, for the 2-stage process of application is already in September of this year. Although the final decisions for awards will be made after the 2nd stage in 2024. For the cancer mission, we don't yet have the work program that will probably be published towards the end of this year. These are the 3 topics I wanted to highlight. We have these specific following an agreement with the Indian authorities. I won't read the topics, but you can see them on the slide. These are in different calls. So one of them is already closing in mid-April. The second topic is going through the 2-stage process, and the deadline for the 1st stage is in September of this year, whereas the last topic is in the single stage process of 2024, and thus the deadline is in April of next year. And in each case, this will be support. The Indian participants in successful projects will be supported by the Indian authorities through the Department of Biotechnology. So I think what I will do now is briefly summarize some of the key principles.
Sorry, Mr. Hogan, you only have 30 more seconds.
That's fine, thank you.
Thank you.
With regards to European research grants, I just mentioned a few basic principles. As I said, the work programs are published on an annual basis. Funding for most topics is about 100% of eligible cost plus 25% for indirect costs. Collaborative research grants require a minimum of 3 independent European participants, of which 1 must be a member state and the other 2 can be either member states or associated countries. Partners from 3rd countries like India can be included, but without funding normally for industrialized countries, with the exception of these topics where there will be a special measure by the Indian authorities. As I said, some in single stage, some in 2-stage. We evaluate through a peer review mechanism. There's an ethics screening, and the time to grant, the time from applying to the award of the grant is about 8 months. But please consult our work program and guides for the details of this. And I'm coming to my final slide. This is just to highlight that we organize regular information days, and the information from these information days is available to the links on this slide. The work programs are also available to the links, and also already I can highlight that the information day for the 2024 call will be on 1st of June of this year. And finally, thank you.
Thank you, Mr. Hogan. I'm sure there's a lot of relevant project ideas out there. And I'd like to say once again, thanks to all of you for making the transformation happen. Let's push the boundaries together. Let's pioneer the possible.